Hi, and welcome to Lemma Dental Clinic. Today, we're going to explain how we renew an old or damaged tooth filling and why it's sometimes necessary. Fillings don't last forever. Over time, they can crack, wear down, or even fall out. Sometimes, decay can turn underneath the old filling without any pain. That's why routine checkups are so important. The first step in removing the old filling completely. We do this carefully with special tools, making sure we don't damage the healthy part of the tooth. Once the area is clean, we check for hidden decay and clean it out if necessary. Next, we prepare the tooth for the new filling. Depending on your needs, we may use composite resin, ceramic, or another material. We carefully layer and shape the material to match your tooth's natural look and bite. Then, we use a special light to harden it. After the filling is set, we polish it and check your bite. We make sure it feels comfortable and looks natural, like nothing ever happened. If your old filling feels rough, loose, or sensitive, don't wait. Replacing it on time protects your tooth and prevents bigger problems later. Need a filling checkup? Contact Lemma Dental Clinic today. We're here to keep your smile strong, safe, and shining.